Good evening, everybody, and welcome to tonight's webinar hosted by AHDB Beef and Lamb and AHDB Dairy. Tonight's webinar is all about cattle parasite control around housing. I'm Katie Bryan, and I work within KT delivering beef and sheep knowledge transfer to English producers. So the presentation this evening is going to be delivered by Dr. Andy Forbes, who is a specialist in ruminant parasitology. Andy is a vet who has not only spent years in general veterinary practice in various countries throughout the world, but he spent a large part of his career in the animal health industry in various technical positions in both the UK and overseas. He now teaches at the School of Veterinary Medicine at Glasgow University, where he is an honorary professor. He's a member of COWS, the Control of Worms Sustainably steering group, and is currently the chairman of the Parasite Control Technical Working Group of the Animal Health Island. So without further delay, I'll hand over to Andy, as I think he's the best person to talk us through the subject this evening.
Thank you, Katie, and welcome everybody. When I was asked to do this talk, I've entitled it Around Housing, thinking it would be probably quite a long time before cattle are housed, but having just spent a week in Scotland, where despite the good weather at the moment, grass growth has not been good, and I found at the farm I was on yesterday, for example, they will be housing their cattle probably within the next few days. So it is topical, certainly in some parts of the country, and obviously for those that house later on, all the information I provide tonight will be relevant for that. The outline of what I'm going to do tonight is essentially go through a little bit of the parasites themselves and their impact. This may be a bit of revision for some of you, but for some of you it might be new, but just to ensure that we're all starting from the same base. We'll then talk a little bit about the principles of control of parasites at or during the housing period, followed by a little bit of guidance and then some more general guidelines on the use of products in general. We'll kick off just by looking at the parasites, and the first thing to say is that the common gut worms, stomach worms, and intestinal worms are present essentially on all farms in all cattle, irrespective of age or location. The only possible exceptions would be those in which cattle are housed from birth until death. So these are inevitably going to be part of the target parasite group which we're going to be looking at. On some farms, they may have lungworm as well. Some farms, and perhaps more so now than perhaps 20 or 25 years ago, a lot of farms will also have fluke, not only the old, if you like, tried and trusted liver fluke, but also this new or relatively new parasite, which seems to have appeared and become much more common over the last 5 years or so, the rumen fluke. So those comprise, in essence, the most important and common internal parasites. And in addition, although you will very rarely see them in cattle at grass, once cattle are housed, they can and do become show signs of infestation with both lice and or mange mites. So they have to be brought into the equation when it comes to control of parasites at housing. Now, just to quickly run through the impact of these parasites, as I say, this may be old hat to some of you. This shows the damage to the forestomach, the abomasum in a cow. This was actually taken from an abattoir survey. The lesions are these round, circular, slightly raised things, and each one of those represents a gastric gland which has been damaged and the cells around it damaged. And the hole in the center is where the adult worm emerged after it developed in the wall of the gut. This is probably the most important stomach parasite in cattle. It causes a number of things, but perhaps primarily and most relevant, it reduces feed intake. Appetite can be reduced by a considerable amount. And this probably accounts for 60 to 70% of the losses experienced by infected cattle. Just simply, they just will not eat as much as an uninfected animal. In addition, you get poorer digestion of the feed and poor feed utilization. So these are very important parasites in both grazing and housed animals. There is an aspect of this parasite which unfortunately does not have really a common name. The scientific name is Ostertagiosis Type II, which is a bit of a mouthful. What it describes is that these parasites normally complete their life cycle in the wall of the abomasum within about 3 weeks. But there is a phenomenon where in the autumn, the larvae, instead of developing through into adults within that 3-week period, remain quiescent, inhibited, call it what you like, in the gastric glands. It's very tiny parasites. And they remain there until usually the late winter, early spring, when they resume development. And if this happens and there's a large population of parasites which emerge simultaneously, then you can get quite a severe clinical disease. And I mention this in a little bit of detail because this is one of the target parasites for housing treatments. The liver fluke is, I'm sure, familiar to most of you. Just a quick reminder of the damage it does. The adult fluke are blood feeders. This is a photograph of an adult liver fluke here. And this tortuous or brownish tract is the gut, and this is partially digested blood inside the gut of the fluke. So they can cause anemia, perhaps not so marked in cattle, but certainly in sheep that can be a very obvious symptom, clinical sign. And they also cause other things like anorexia in the same way as the stomach worms do, so reduced feed intake. But the liver, as I'm sure you will all know, is an organ with a lot of important and diverse functions. So once you get liver damage from the presence of liver fluke in the tissue and in the bile ducts, you can get a lot of other more diverse effects, if you like, just from the fact that the liver is damaged. And last but not least is this phenomenon called, again, a long word, immunomodulation, which simply means that the immune system is affected by this parasite. And without getting into too much detail, what it means is an animal, a cow infected with liver fluke, is less able to respond to other infections, particularly bacterial and to some extent viral infections. And so this can mean that, for example, diseases like salmonella can become more serious in an animal with liver fluke. And perhaps very importantly in the current climate is that they can also be more susceptible to tuberculosis and give false results in the intradermal skin test. So this is an aspect of liver fluke which has become much more important as new research has discovered these different elements. Another quick reminder, I think, at this stage is about the disease in cattle as opposed to the disease in sheep, because this again becomes relevant when we talk about treatment at housing. In cattle, the main pathogenic stage of liver fluke appears to be the adult liver fluke once they're in the bile ducts and in the gallbladder, or in the bile ducts specifically when they're feeding. Unlike in sheep, where the immature fluke migrating through the liver are a very significant and important cause of disease, in cattle it appears that there's less damage or that the cow is able to cope better with that migration through the liver tissue, but once the fluke get into the bile ducts and start to feed, that's when you will classically see the clinical signs and the ill thrift and associated signs you get with liver fluke. Just a few words about the new parasite for those of you who may not be so familiar with this one. This is the rumen fluke. This is a picture of the parasites in the lining of the reticulum. This is in an abattoir specimen. You can get an idea of the size from the fingers here. So they're quite visible to the naked eye, and they can cover large areas of the rumen. However, despite their large size and quite often presence in large numbers, there is still quite a lot of debate as to whether they actually cause much harm at all. There certainly are no or very few visible, even microscopic lesions associated with where they're attached to the rumen. And as I say, currently it's thought they're relatively harmless. In contrast, the young fluke, which for reasons best known to themselves develop in the small intestine, the duodenum, so that's further down the intestinal tract than the rumen, obviously, can cause, as you can see from this picture, severe inflammation and thickening of the duodenum, and that can cause diarrhea, severe diarrhea, and loss of condition. And a picture from a description of this disease in the veterinary record from a few years ago shows an animal with disease caused by immature rumen fluke, and I think it's fairly obvious to all of you there that it's diarrheic, it's in very poor condition, it's dehydrated, and it's obviously quite depressed and not a happy bunny at all. So has to be said, seems to be quite a rare manifestation of this infection. Mostly it's just you find adults with no particular consequences, but clearly when the disease caused by the young fluke occurs, it is potentially quite serious. So collectively, and this is similar in essence, with whether it's gutworms or whether it's fluke or both together or either, the effects on performance are, you could almost say, generally of ill thrift, if you want to use that sort of expression. So in other words, it's poor growth rate in young animals, and in older animals, poorer performance, whether that be milk yield, sometimes fertility can be affected, and the efficiency of the use of feed, especially in house cattle. And of course, the knock-on effects from poor growth rate include things like pregnancy rate in heifers, which have to grow at a certain rate, or at least they have to be at a certain weight before they can be served first, and if they're growing slowly, then they won't get to that weight, which is typically about 15 months if you're looking at a 2-year calving. So these helminths, the gutworms and liver fluke, etc., can all affect these, and therefore they are potentially can impact on the performance of farm economics. Lungworm may cause poor performance, but it's perhaps more usually associated with actual clinical disease. So that is animals which are coughing and showing respiratory distress, particularly when they're at pasture. And it's a consequence of having their major airways, the bronchi and sometimes the trachea, full, as you can see, with these quite large worms, looking again at the size of the thumb here, which can fill the airways, and clearly it's very, very difficult to breathe normally when you've got bunches of spaghetti in your trachea. So more commonly, perhaps it causes a clinical disease, but on the other hand, and relevant to tonight's topic, if an animal goes into a housing period and it has that sort of damage to its lungs, then it's highly likely that it will be more susceptible to some of the more normal, if you like, or typical causes of pneumonia in house cattle, so bacteria and viruses and mycoplasma. Hence, this is perhaps more of a reason to consider lungworm at housing would be the predisposition to respiratory disease as opposed to just poor performance in general. Moving on to the external parasites. Now, these are actually present in cattle over the summer period, at the grazing period, but normally they're not visible because they are sensitive to ultraviolet light. They like the humidity of a long winter coat, and they spread much more easily in cattle which are in close contact with each other. So once they're housed, the coats grow thicker as a consequence of getting into the winter period. Cattle are often shielded from direct sunlight, so the ultraviolet light levels are low, and of course they're in close contact in yards and sheds, much more so than outside. And so this gives the parasites an opportunity to multiply and build up to levels which can cause clinical signs and distress to the animals. You can get clinical disease with external parasites. You can certainly get behavioral changes. You know, the scratching and rubbing may not seem much, but actually it can interfere with performance. And not only that, but if you have for example, in a cubicle house, they can actually make quite a mess of the cubicle house if they are scratching constantly. So those are two important changes in animals with clinical or important levels of lice and mange. And you can certainly get production loss as a consequence, and although perhaps of less direct importance for the farmer because they're not directly rewarded or punished for this, but certainly the leather industry will observe that hide damage is quite commonly associated with, for example, lice infections, and that reduces the value of the hide. So these are all reasons why external parasites are also a legitimate, if you like, target for control. So that's a brief run through the parasites. This is, again, just to list them as we've gone through them. So stomach worms, lungworms, liver fluke, possibly rumen fluke, and external parasites. The ones in red, I would argue, are probably the most common and perhaps the most important on most farms. But as I say, it does depend on the farm history and obviously which parasites are present, but they would be the major targets amongst the others. Now, housing is actually quite an opportune time to treat, and we often talk in terms of parasite control of the importance of doing it sort of farm by farm, because every farm is different in terms of its management, its grazing, its other livestock, etc., its targets, what type of enterprise it is. But a lot of the principles of housing treatments actually apply pretty much across the board to most cattle farms, and so it does make it somewhat easier to provide generalized advice. And it's an important time because all these helminth infections, that's to say the liver fluke, the worms, the lungworms, are all acquired from pasture. When cattle graze, they ingest basically the larvae, the immature stage of the parasite, which then get into the animal and develop and become adults and breed and obviously also potentially cause disease. But once they're inside, there's essentially very little to no new infections arriving. So if any sort of treatment which is applied after they've been housed should keep those cattle clean of those parasites until the next grazing season. Generally speaking, silages and hay carry very low, if any, of these infected larvae. They just don't survive very well in those feedstuffs. So that can virtually be dismissed as a potential cause of infection. In addition, the worm eggs, which are normally passed out in the dung in animals which have parasites inside them, they again do not survive very well in slurries or in manure. Again, it's not a question of zero, very little is in biology, but very low numbers survive in the dung. So if the dung can be spread the following year, there is a very low risk that you'll cause some partial contamination, but overall the dung is a sort of a dead end for all these eggs, and therefore there's no sequel in terms of reproduction of the parasites. And the other things are more general things. It can, if you're handling animals in groups, it can be quite easy to treat them or to handle them. You can obviously control the nutrition more precisely under housing conditions, and it's just maybe a convenient time to treat animals anyway when they're being brought in and probably being handled for other reasons at the same time. So what are we trying to do? Well, if we do remove these parasites, which they've picked up during the grazing season, we can hopefully get them through the winter with none of these negative effects which we've talked about in the first part of the presentation. We can also avoid the risk of this specific disease, Ostertagiosis Type II, so that's the larvae which inhibit and don't develop until the following spring. We can help reduce the risk of pneumonia by ensuring that animals have hopefully lungs which are free of lungworm prior to the higher risk, if you like, of other types of pneumonia. And it also means that when the animals go out the following spring, those that are being kept on will not contaminate the pastures with any eggs or larvae from parasites which they have over the winter period. So there are lots of potential benefits of what is a relatively straightforward procedure, and that's a housing treatment. And in addition, a housing treatment can kill or reduce any populations of lice or mange, which, as I say, will be on the cattle, just won't be visible, and therefore reduce the risk that populations will increase over the winter and cause problems perhaps the following late winter or early spring. I've changed here, if you like, from talking about control to treatments, because this is another feature, if you like, of control of parasites at housing. Unlike when they're at grass, when there are some other management things that can be done to control parasites, actually at housing we are pretty reliant on the anthelmintics and external treatments to control parasites. There's not an awful lot that can be done in the way of straight management, apart from the usual good husbandry things and good nutrition and stuff like that. Now, the choice of products is, of course, can be quite wide, and it is not just a question of which product kills which parasite, although that's clearly one of the important components of it. There are other considerations, and these may well be farm-specific or farmer-specific, from, for example, things like how long does the product last, which is perhaps more important for grazing animals, but it still can be important in control of external parasites in the house. The administration method is often quite, some farmers feel quite strongly about whether they want to pour on, or whether they want to inject, or whether they want to drench. And so these can all influence the choice of parasite treatment. And in addition, as I guess everybody probably knows, resistance to some of these treatments has either been observed already or is a potential threat in the future. And a lot of what we recommend nowadays in terms of use of products is to try and either avoid any practices which might increase the risk of resistance, wherever that's feasible at farm level. Now, I would urge you all to make use of the information that's available when you are choosing and using a product. I'm not being biased here by saying that I think this is one of the best bits of guidance you can get, and that's this listing of parasite control products for sheep and cattle. And I say that because not only has it got a lot of very good summary information, but also it has all the commercial products available, because as you'll see later on, you can't possibly list all the commercial products when you're going through a summary talk like this. And if you want to know what a particular brand name, what it contains, then this is, I would argue, one of the best places you can find it. It's available as a hard booklet, but also it can be downloaded on the website. And for more detailed information, if you go either to NOAA or to the Veterinary Medicines Directorate, they have downloadable PDFs of all the detailed product information which can be found in these resources if you need to go further than just what's on the labels or what's in this summary guide. And take advice. Obviously, your vet or your SQP at your farmer store are two who should be well informed about these products. Your peers, other farmers, may have some useful advice, but they may have some not such good advice. So I think, as with all these personal recommendations, you might just want to double check cross check with somebody else. And of course, in this day and age, we can go onto the internet till the proverbial cows come home and find out information there very, very easily. But do it, because I mean, I do it myself, even although I'm supposed to be quite good at this kind of stuff. I will always reread the label, just check, make sure I've got the dose right, make sure I've remembered any other aspects of use, and just a good reminder of what you should be doing. Don't rely on your memory, in other words. So as I say, this is a comprehensive list of the actual products that are available, but not the trade names. I've just used some examples of trade names. There are many others available, so you would have to look at the AHDB guide to see what's what. And it's just a little summary of the three main groups of anthelmintics and parasiticides which we have available. The first group, perhaps you most commonly know as the abamectin type group. The next ones are the sort of white drenches, the benzimidazole so-called, and then there's a group called the levamisols. And this is just a very, just picking out what I think are quite relevant for this particular subject. One is their activity against these inhibited larvae, which we talked about previously. All these abamectin type products are highly effective against inhibited larvae. The white drenches are quite variable, and the levamisols have no activity against these parasites. So if these are a target for control, then probably these abamectin type products are the best ones to go for. I put in meat withholding just as a reminder, if you like, that although some of these are relatively short and probably of no great importance in terms of treatment at or around housing, some of them are slightly longer, and if you do have animals which might be going off to slaughter within a couple of months of housing, just make sure you're not going to infringe those withholding times. So that's, in essence, that covers both. All these products will all kill lungworm too, by the way, so that's not an issue. They all will be equally effective against that, and they will all kill adult Ostertagia. So that's not an issue. It's just these inhibited larvae which needs to be borne in mind in terms of choosing one of these products. If we move on to liver fluke now, just a quick reminder, this is figures from the government. in terms of submissions through the government diagnostic labs, just to really make the point that liver fluke in cattle is a year-round problem, but undoubtedly the majority of cases are seen over the winter months from sort of January through till turnout. It's when most of the clinical and important diagnostics are made. Hence, a reason to target it at housing. There's quite a choice of fluke products can be used, and this can be, in my view, made as either simple or as complicated as you want to. I personally, hopefully, will try and make it as simple as it is. The first thing, again, a similar list. Don't again try and remember any of this. It's just a reminder, if you need it, that the different flukicides have different activity according to the stage of the liver fluke. The liver fluke, in essence, after immature has been ingested by the animal, it takes about 12 weeks typically to become an adult liver fluke, and one which is going to be laying eggs. And the different flukicides, some of them will only kill the adults, so these are 12 weeks old liver fluke, and that's these products listed at the bottom here. Some will kill fluke from about 6 to 8 weeks upwards, so these are sort of later matures and adults. They all will kill adults, incidentally. And then this group here, the ones which contain triclopendazole, will kill the very young flukes down to a couple of weeks of age. So depending on what you're trying to do, you may need to choose one of these different types of product, but as I'll show shortly, you can use any of them. You just need to maybe adjust some of your approaches depending on which product you choose. They are available here, as you can see, in oral, injectable, and topical formulations. So for people who have a particular hang-up about how they give them, then there should be something for everybody. And again, just a quick reminder that some of these withholding periods are relatively long, so just make sure you're not going to infringe those. So I've tried to be try and simplify this as much as I can. Treatment actually at housing, I mean on the day of or within a week or so of housing, is quite common for the reasons we just said, and makes a lot of sense. But in terms of liver fluke specifically, there's just one or two kind of additional points that need to be made. If you use this product which kills the very young liver fluke, the recommendation is you treat 2 weeks after housing, and that should be sufficient. That should effectively kill all the liver fluke inside the animals at the time of treatment. The one caveat to that, and it's an important caveat, is that there is seemingly quite a lot of resistance to this compound. So you would need to determine, hopefully via your vet or somebody locally who has specialist knowledge, as to whether either you have resistance on your farm or whether you might have brought in cattle which could be carrying resistant liver fluke, because clearly if they are resistant, then this treatment is not going to work. Other than that, the other types of compounds, so these ones are active against the 6 to 8 week old fluke and older. You can treat at housing. There's no issue at all with doing that, but if you do that, you may want to monitor them about 8 weeks later, because these won't kill every fluke in the animal. It's possible they may need to be retreated. If you're just fattening them and they're not going out to grass again, monitor the weight and the condition, and if they're on target, then there's really no need to retreat them. If you want these animals to be completely clean of liver fluke, perhaps they're going to go out to graze the following year, then the best thing to do is to take some dung samples and get them examined to see if there are any fluke eggs, because by 8 weeks after housing, any surviving fluke should be adults and producing eggs. And the similar argument really applies to the adulticides, the ones that just kill adult liver fluke, but in this case you would probably extend the interval for follow-up to about 12 weeks, to ensure that any fluke present are adults, and then you can retreat again as necessary. And this retreatment can be with any product, because once the fluke are adult, any of these compounds will be effective, obviously including triclopendazole if it's working. So that really, I think, is the sort of the simplest way: treat at housing, and then possibly and then follow up with treatments which don't kill all stages, and determine depending on what you're trying to do, whether you're trying to get sterile animals with no fluke in at all, whether you just want them to grow, and then you can make a decision as to about whether you need to retreat or not. It obviously potentially is going to cost you more because you're going to have to treat twice potentially, but that's a thing which you have to factor into your decision. The other thing is rather than treating immediately at housing, for liver fluke specifically, you wait until all the fluke are essentially adults or late immatures and adults, and then you treat them. And so for that middle group of compounds, you would delay treatment for about 8 weeks after housing, and for the ones that only kill adult liver fluke, you would delay typically for about 12 weeks. The important caveat, if you like, condition of that is that you monitor these animals, because you're not treating them for between 2 to 3 months. If they do happen to have a large burden of liver fluke when they're housed, then clearly they're going to suffer performance losses and maybe even disease before you get round to treating them. So you should keep an eye on these animals and make sure that they're doing okay. Otherwise, you would need to treat them before this interval here and then possibly retreat again. And the other opportunity during the winter is in the dairy herd with dry cows, where if you can treat them, I mean, this is best applied in a spring calving herd or for cattle which calve in spring, which will be dry around Christmas time, and that will be a good time to treat them when the liver fluke are mostly adults anyway. But be aware, and every time I put this slide up, I'm keeping my fingers crossed that nothing has changed since I last did this slide, but I did check before the lecture tonight. Only a few of these flukicides are actually licensed for use in dairy cattle, either 2 in the lactating cattle with a milk withholding period, and 2 others can be given during the dry period, providing there's a sufficient interval between the treatment and when the animals are expected to calve. And I emphasize this, and I say it to myself all the time, please check if you are in a dairy herd, that make sure you've got the latest information available. We'll quickly run through external parasites. They breed quite quickly, but not mega quickly. So generally speaking, as I say, you don't get a buildup of lice or mange infections until the second half of the housing period. There's only basically 2 choices of treatment, or two groups of compound. One called the pyrethroids, and again, there's some names that are hopefully you'll be familiar to some of you. And the others, again, are the ivermectin type products. And they have different, slightly different spectra of activity, particularly against the mange mites, and some have persistency and some don't, so that some will keep being active several weeks after treatment, and some won't. None of them kill all the different types of parasites, but as you can see from this chart, probably a topical ivermectin or a pyrethroid will generally cover the most common of the external parasites of cattle, this species being quite rare and hasn't been reported recently as it was a few years ago. A few tips really: treat them all at the same time. These are contagious diseases, and if you leave any untreated, they will just reinfect the other ones. And in a similar way, avoid contact with untreated animals. And other measures are good nutrition may help with a lice infection. Lice are usually seen on cattle in poor condition. Now, just to round off, we're going to just quickly go through some things about the treatments themselves, and just a few comments about responsible use of these things, because it is a time when we do rely heavily on these compounds to try and establish a good control of parasites over the winter period. And one thing, for example, which is often questioned is whether combination anthelmintics are a good or a bad thing, if you like. They were made to be convenient, as simple as that, so that hopefully with one treatment you can kill both fluke and worms that are present. So it's pointless to use them if you don't have a liver fluke, but obviously if you are targeting liver fluke at housing, that it makes absolute sense. And the other thing is that as I said at the very first slide, all cattle have gutworms, so treating them at the same time as treating the liver fluke is actually quite a solid thing to do. So I don't think we should be sort of sneering at these kind of combos. They do have an important role to play, certainly at certain times of year in certain groups of cattle. Again, just a quick list so you can get some idea. I haven't put trade names in here. In this case, it just simply wasn't room on the slide. But it's really just again, not to be read in any detail, but just so that you can see that actually no single combination product actually does everything of, if you like, of the important and common parasites which we're trying to cure. So none of them is necessarily the total answer, but obviously some of them do get a lot closer to being to treating virtually everything with literally a single treatment out of a single bottle. On the subject of combination products, it just happens to be done. This was done with some combination products. At least these two were. Another component just of choice, which I think is relevant for tonight, is just to remind people that, and this was actually done with cattle going through a race, and the farmer was treating them, how long it actually takes, and this is how long it takes to treat 5 animals, and basically you can see that if you're using an oral drench or something which requires the animal to be restrained and treated individually, it took essentially about a couple of minutes, which is still not very long, but it's time. Whereas going along with an injection, which is easy to inject, was very much quicker, about 5 times quicker. In this study, there was an injectable which wasn't so. It was a bit thick to inject in the winter, and it was quite a bit slower. So again, when we talk about product choice, these are all things which can be factored in, and which you as farmers may have your own preference for this. The cows group, for those of you, I'm sure hopefully you will know about this, it aims to provide this sort of advice which we're going over to tonight. And I would urge you to look at their website, and they also, if you happen to be one of these people who Twitter, then they've got things like that as well. Their sort of guidelines on wormers, again, I'm not going to read these out for you, but you can just, they're fairly short and sweet. You can read them in your own time. It's just common sense things, if you like, to make sure you do use the right products for the right parasite at the right time. The right time in this case is housing. So, but if we look at the Flukicides, for example, there are timing issues which are relevant to that group of products. And in terms of accurate dosing, please remember that the only accurate way to weigh to get an animal's body weight is to weigh it, and that's basically not a discussion. Well, except if you include weigh bands, I guess that is another legitimate way of getting weight, but you cannot do it by eye. And this is just a very quick run. Well, look at a couple of slides from a study which was published last year, as you can see there from the screen, looking at a number of experienced cattle vets and dairy farmers, looking at some Holsteins. So they weren't even animals of mixed ages; they were adult cows, and you can see there the sort of weight range they had. And they were asked to observe or guess what they thought the weight just by visual inspection. They were then given the weight of one of the animals, so they had a reference point within that group, and then asked to re-evaluate the weights. And this is the result. This is the number of them who underestimated the weight. And as you can see, there was not a lot of difference between the vets and the farmers in this. The majority of vets and farmers underestimate the weight, and therefore if they were dosing these animals, they would be underdosing them, and that has all sorts of ramifications, which I'll mention in a second. And the magnitude of the underestimate, as you can see, was not trivial. We're talking, over 50 kilograms, over 60 kilograms for the vets, and over 90 in the first instance for the farmers. And the worrying thing to me, I have to say, although I'm probably, none of us are innocent about this, is that the accuracy was not greatly improved even once they had a reference weight for one of the animals. So that's a bit of a story there to keep us on guard. And just to re-emphasize, underdosing means you get poor efficacy, shorter level of protection, and you do increase the risk of resistance. It's one of the risk factors for resistance, so we shouldn't be doing this. And the other scale is less common, but if you do overdose, Most of these compounds are quite safe, but there is a risk of toxicity with some of them, usually with fairly gross overdoses. And remember that withholding periods are based on the recommended dose. If you give too high a dose, then you should really extend the withholding period. Whatever you do with parasite control, in my view, has to be done within the context of what your farm objectives are, your aspirations are, and what your targets are in terms of performance, cow performance, and cow health. And housing is no exception to this, as far as I'm concerned. So anything you're doing to control parasites during the housing period has to be seen within this context. So in finishing, I'd just like to remind you again and refer you to the 2 websites, which I think you'll find quite useful in terms of anything to do with parasites or in animal health. There's more than just parasites on there. I'd like to thank people I work with in those 2 groups, and also colleagues at the University of Glasgow Veterinary School. Thank you for listening.